All right, let's go ahead and get started. Good afternoon, good evening, good morning. Welcome to everyone, and thank you so much for joining us. We're really excited to have you for today's 101 briefing on the U.S. appropriations process. My name is Ansley Moore, and I'm the Director of U.S. Advocacy and Engagement with Global Health Council. For those who may be newer to our community, GHC is a trusted convener, connector, and catalyst for collective action. We bring together the full spectrum of the global health community across borders, sectors, and disciplines to share knowledge, act together, and hold leaders accountable. Today's webinar is part of that mission. The U.S. appropriations process plays a critical role in determining how much funding is allocated to global health programs each year, and ultimately how effectively we can respond to health challenges around the world. Understanding how this process works is essential for anyone engaged in policy, advocacy, or implementation. And during today's session, we'll walk through some of the main moments of the U.S. global health appropriations process, including the overall timeline, key milestones in Congress, and major decision points that shape final funding levels. We'll also highlight where and how stakeholders can most effectively engage throughout the process. Whether you are new to federal budgeting or looking for a refresher, I see some old pros in the audience as well. We hope this overview will strengthen your understanding and support your work in advancing global health priorities. Thank you again for being here, and we look forward to the conversation. Next slide, please. This is just an agenda for today. Like I said, we're going to go over the U.S. budget and appropriations process, some major milestones in that process, how GHC and other folks can engage, and then we want to save the latter half of the meeting for question and answer and a more interactive dialogue. So appreciate your patience and look forward to your questions towards the end of the session. Next slide, please. So please note the following some housekeeping items for today's meetings. You can use the chat for questions and comments during the presentation. Like I said, there'll be an opportunity to raise your hand and ask questions and have a more interactive dialogue a bit later in the session. Please remain on mute when you're not speaking and unmute yourself only when you want to speak. You can click on participants and share reactions to see who else is in the Zoom room. And just note this session is being recorded and the recording will be shared as soon as possible after the session. Next slide, please. Today's session is brought to you by GHC and our Budget and Appropriations Working Group and our co-chairs. So that's me alongside Fata Acquoi, the Senior Congressional Lead at PATH, and Alex Long, U.S. Policy and Advocacy Officer at the Global Health Technologies Coalition. Thank you both for all that you do on behalf of the working group and for co-leading today's session with me. And Fata, over to you.
Thank you, Ainsley. Hi, everyone. Thank you for joining this webinar. Before we begin, we just wanted to walk through some acronyms that we will be using. As advocates, we get really lost in the acronyms, but this is a way for you to kind of understand the context of some of the organizations, some of the accounts that we will be mentioning during today's webinar. So starting from the left side, CDC, the Center for Disease Control and Prevention, CEPI, the Coalition of Epidemic Preparedness and Innovation, CIO, which is a specific account for the contributions for international organizations, DA, that is Development Assistance, ESF, Economic Support Fund, FP, or you will hear RH, which is either Family Planning and Reproductive Health, HRSA, Health Resources and Services Administration. We have GHS, which is Global Health Security. You might also hear GHSD when we refer to a specific bureau at state. There's IONP, which is the International Organizations and Programs Account. MCH, Maternal Child Health. NIAID, or NIAID, which is the National Institute of Allergy and Infectious Diseases. NIH, which is the National Institutes of Health. NSIP, or NSIP, the National Security Investment Programs. You have NTDs, which is Neglected Tropical Diseases. PEPFAR, the President's Emergency Plan for AIDS Relief, TB, tuberculosis. We also have UNFPA, which is the United Nations Populations Fund, WASH, which is Water, Sanitation, and Hygiene, and lastly, WHO, which is World Health Organizations. Next, please. I want to just walk through quickly some terminologies that you will hear consistently, not only just on this webinar, but within the US government space. So starting off with appropriations. Appropriations is a bill, the appropriations bill, is a law by Congress that provides federal agencies with budget authority, meaning the legal authority to obligate and spend federal funds. Without an enacted appropriation or spending authority, agencies cannot carry out funded programs. Appropriations also determines how much money can be spent, for what purpose, and for what time period. Next, we have report language. Report language refers to the explanatory text that usually is accompanying appropriations bill, is included in the committee report. While it does not carry the same force of law that the bill text does, it does provide congressional intent. So usually it has guidance, direction to federal agencies on how the funding should be implemented. It can encourage specific programmatic priorities, direct agencies to brief Congress, request reports or data, or signal support or concern for certain activities. Multi-year appropriations refers to, it provides budget authority that remains available for an obligation for more than one fiscal year. So meaning that once funding is obligated for multi-year, these funds allow agencies greater flexibility to plan and implement longer term programs, including multi-year contracts and international initiatives. Many global health and foreign assistance accounts you'll see receive multi-year funding to accommodate a longer implementation timeline. Rescissions. Rescissions refer to the cancellation of previously enacted budget authority. In other words, Congress can take back funding that it had already approved. So a rescission, one, it reduces or eliminates funding that was previously appropriated. It can apply to unobligated funding, meaning funding that has not yet been committed. Also, it changes the total available funding for a specific program or a specific account. The rescissions also are enacted through legislation and must be passed by both chambers of Congress and signed by the president. Annual appropriations, which is most of the conversation for today. Annual appropriation refers to the fiscal year, a fiscal year or 1 year appropriations, which provides funding that is available for obligation during a single fiscal year. It usually lasts from October 1st to September 30th. Unless otherwise specified, these funds expire at the end of the fiscal year if they're not obligated. Congress usually passes 12 appropriations bills annually, which cover specific federal departments and agencies. We will specifically today be talking about the Labor, Health, and Human Services Education and Related Appropriations Act, or LHHS, as well as the State Foreign Operations and Related Programs Act, or SFOPs. Lastly, continuing resolution. A continuing resolution, which is a CR, is a temporary legislation that allows the federal government to continue operating when Congress has not yet reached a final decision on appropriations, which means that they have not yet enacted a final appropriations by the start of the fiscal year, which is October 1st. CRs typically do three things. They extend funding at the prior year level or at a moderate rate. They restrict new program starts, and then they limit funding increases or changes in policy. They can last from days to weeks to months. If Congress doesn't pass either a full year CR for appropriations, the government usually shuts down, or you see a lapse in funding. I will turn it back over to you, Ansley.
Thanks so much, Fata. I know that that was a lot of information to take in just on the acronyms and the terminology, and you did a fabulous job explaining everything. So now we sort of wanted to jump into an overview of U.S. global health funding. This chart is from the Kaiser Family Foundation, or KFF. They have a lot of great data if you want to learn more. So this chart shows that U.S. global health funding has evolved significantly from FY 2006 through FY 2025, with more rapid growth early in the 2000s and relative stability over much of the past decade with a temporary surge during the COVID-19 pandemic. But it's important to view these numbers in the context of the structural and policy changes that have taken place over the last year and a half. In addition to the release of the America First Global Health Strategy, this current administration has been reshaping how U.S. global health programs are delivered. That includes negotiating new memoranda of understanding with partner countries and signaling a shift toward more government to government agreements with an emphasis on more country ownership and alignment with U.S. national interests. These changes aim to affect not just funding levels, but how programs are structured, implemented, and ultimately overseen. It's also important to note that in the last year, Congress has rescinded billions in foreign aid funding, including hundreds of millions of dollars previously appropriated to global health, which has reduced available FY25 resources. Also, recently, Congress has passed the FY26 funding package. The top line outcome was stronger than I think a lot of us expected, compared to the president's budget request for FY26, along with all the changes that I just mentioned. State Department global health programs were funded at approximately $9.4 billion, which is about a 6% cut compared to FY25 enacted levels, but way above the president's budget requests. In fact, about $5.6 billion above the president's budget request for that year. There were also important preservation decisions. Notably, the CDC's Global Health Center was maintained at FY25 levels despite the president's proposal to eliminate it entirely. Broadly speaking, the pattern in the final package could be described as holding the core accounts relatively steady and trimming at the margins, though those reductions are significant, while adding oversight. As I said, many of the largest global health accounts were flat, but there were meaningful reductions across areas such as TB, neglected tropical diseases, global health security, and family planning and reproductive health. So as you look at this trend, it's not just about the top line numbers, but the architecture of US global health, who implements programs, how funds flow, and what policy conditions are attached is evolving in parallel with the appropriations levels themselves. And understanding both the funding trajectory and these structural shifts is critical for effective engagement in the appropriations process. Next slide, please. This slide breaks down U.S. global health funding by sector based on KFF data. As I said, they're a great resource. As you can see, funding spans a wide range of program areas, including HIV through PEPFAR and the Global Fund, maternal and child health, malaria, TB, neglected tropical diseases, family planning, reproductive health, nutrition, and global health security. Historically, HIV has represented the largest share of bilateral global health funding, reflecting the longstanding U.S. commitment through PEPFAR, the President's Emergency Plan for AIDS Relief, followed by multilateral contributions like the Global Fund and other core global health accounts. This distribution reflects decades of bipartisan prioritization and the structure of major U.S. initiatives. It's really important to note, too, that this graph reflects how funding was appropriated by Congress in FY25, but not necessarily how it was ultimately obligated or spent. Last year, amid the administration's foreign aid freeze, stop work order, and widespread program cancellations, a significant portion of the FY25 funding didn't reach implementing partners or communities in country. So while these figures show congressional intent and appropriation and sectoral priorities, they don't fully capture disruptions that happened last year. And that distinction between what is appropriated and ultimately delivered has become an increasingly important part of understanding the current global health landscape. Next slide, please. And I think back to you, Fata.
Thank you for that context, Ainsley. So we want to just walk through what the appropriations process looks like and the roles that you will commonly hear and see when it comes to the movement of the bills. So starting off with the top, a subcommittee So each of the 12 appropriation bills, there's a subcommittee that drafts these respective bills. They also hold hearings with agency officials. They conduct something called a markup, where members debate, amend, and also vote on the bill. If approved, the bill then advances to the full committee. The full committee is the full appropriations committee that considers the bill. This is also a time where additional amendments can be offered, and members from the full committee vote on whether to report the bill to the floor for larger congressional vote. Floor votes, or the votes, can happen in either the House or the Senate. The chamber debates and votes on the bill. The difference between House and Senate versions are resolved. Oftentimes, that's probably through negotiation or something called an omnibus package. And then the final passage requires approval by both chambers of Congress, as well as a signature from the president. The committee chair is from the majority party. The committee chair leads the appropriations committee or the subcommittee. What they do is they set the agenda and the schedule of the hearings or the markups. They determine when the bills are considered. They work with committee staff to draft the appropriations bills and report language. They also help negotiate with their party on the funding levels. And the same thing, both House and Senate. And they play a central role in the final kind of bipartisan negotiation that happens. A ranking member, or the ranking member, is a part of the minority party. The ranking member is the most senior member of the minority party on that committee. They usually serve as the lead spokesperson for the minority party. They negotiate the funding priorities and policy provisions. They offer amendments during markup. They work to influence the report language and bill text, and they also participate in those bipartisan negotiations. Although the majority party does control the agenda, the appropriations bill often requires bipartisan cooperation, giving both the ranking member and the majority member, the chair, meaningful influence to be able to influence what the final outcome of the bill should be. Next slide, please. All right. I know this is a lot. You're probably like, that is a lot of things on one page. So I'm going to try my best to explain this chart in the current new policy context that we're in. So I'm grateful that Ansley went before me to give that context to you all. So all U.S. global health funding continues to be authorized through either the State Foreign Operations Act, or the SFOPS bill, or the Labor Age Act. However, the current and new institutional architecture for delivering these funding has changed significantly under the current administration. So as Ainsley mentioned, the America First Global Health Strategy, as well as the administration's new way of doing foreign assistance, has reframed how U.S. health assistance will move forward. And most of it focuses on rapid outbreak containment or performance-based bilateral agreements, rather than the traditional development models that we're used to. So this chart, although it identifies the different accounts and the sub-accounts, how the funding is obligated and distributed is kind of up for debate. So the major funding accounts. So you have the bill at the top, that is the appropriations bill, the state foreign operations and related programs bill, SFOPS. Underneath it, we see the global health programs at state. We see the economic support fund. We see the development assistance, DA. We see the contributions for international organizations, CIO, and then we see the international organizations and programs. So these are all account specifics. So those are the major big pots that the funding is coming out of from that bill. Then the next step, which is the sub accounts. These sub accounts, unlike the past where these accounts were implemented primarily by USAID, state now holds the responsibility for planning, obligating, and managing these funds. So the breakdown of these funds within the global health programs account specifically, Congress identifies priority areas, which are now being interpreted and then applied by state. So these include, from left to right, we see there's PEPFAR, there's HIV as at state, there is malaria, There is nutrition, there is vulnerable children, tuberculosis, TB, NTDs, neglected tropical diseases, maternal child health, MCH, including polio. We have family planning and reproductive health. We have global health security. We have emergency response fund. And then we have WASH, which is water, sanitation, and hygiene. Again, while the appropriation structure remains familiar, this is how things have been appropriated in the past. I do want to flag that the policy direction under the new America First Global Health Strategy includes performance expectations, and that also then changes how these funds will be deployed in practice. When it comes to these accounts, there's also sub accounts in green, or these other accounts, which are the multilateral organization accounts. That includes the Global Fund to fight AIDS, tuberculosis, and malaria. That includes the Pandemic Fund. That includes the Coalition of Epidemic Preparedness and Innovation, CEPI, includes UNICEF, it includes UNFPA, the United Nations Population Fund, Gavi, the Vaccine Alliance, UNAIDS, as well as, well, WHO, there's a conversation about that. That's why there's a dotted line of the US participation in WHO. I want to note that you see that certain funding on this chart are pulled out of these sub accounts. So what we see is that, for example, Gavi, the Vaccine Alliance, its funding is actually allocated within the maternal child health account. Same thing under global health security. There is a breakdown of what the bilateral is, but there's also what these other multilateral funding are coming from. So you have pandemic fund funding and you have CEPI funding that is pulled out of that global health security account. Same thing for international organizations. You see UNICEF and UNFPA being pulled from there as well. PEPFAR, you have PEPFAR as state, and then you have the HIV AIDS sub account, which also has a UN AIDS specific kind of funding that is pulled from there. Although this funding chart mentions, global health, and it talks about the State Department, State and Foreign Operations, we also have implementing agencies like CDC, which also implements PEPFAR. We also have the other agencies like the Peace Corps. We have DOD. We have HRSA. And so those are all kind of playing a role. But who kind of holds the distribution of the funding, the sub accounts? You see that state, really specifically the Bureau of Global Health Security and Diplomacy, as a primary implementer and coordinator under the new structure. I'll end to say that, as we look at the America First Global Health Strategy, it represents a huge policy shift in how global health funding is conceptualized versus how it's deployed. So this shows the structure of how it is conceptualized. This is how Congress has allocated and obligated funding to be appropriated and distributed. But because we're now going under bilateral agreements tied to performance and co-partner investments, how it's going to be deployed is a different conversation as we look towards what state is now producing out of these MOUs. I'll stop there and I'll turn it over to my colleague Alex to talk about the other accounts.
Great. Thanks so much to both of you for leading us off, and happy to talk about LHHS, or Labor, Health and Human Services, an education and related agencies bill. But as you can see here, it's, formatted just like the last slide. And I guess like a baton pass, I will start where Fata left off and start with CDC, because on that slide, it mentioned that there are interagency agreements between the State Department and the Center for Disease Control and Prevention, or CDC. And those fund like a fair portion of CDC's global health activities, especially when it comes to the PEPFAR work, previous PMI work, and then previous work on NTDs. I say previous because some of these interagency agreements are in flux right now, especially because of the transfer of so many funds and authorities to the Global Health Security and Diplomacy Bureau at the state. So we are trying to honestly work that out as an advocacy community so that we know how to advocate for that programming moving forward, since that interagency agreement between the State Department and the CDC is such a key part of like how global health actually gets done. So I'll start there. And those are all funds that, rest within the SFOPS bill or the NSRP bill, as Fata mentioned. But then when you actually get into the LHHS bill, CDC still has its own global health programming through the Global Health Center. And you can see below on the slide, the Global Health Center, there are different divisions within GHC. And I will flag that the Division of Parasitic Diseases and Malaria, which is listed in congressional budgets under the Global Health Center, has topically moved actually from GHC Global Health Center to NCEZID, or the box to the right of the Global Health Center on your screen, the National Center for Emerging Zoonotic and Infectious Diseases. So I am only articulating that because for those who on this call focus on malaria or NTDs or parasites more generally, this division has been moved over to NCEZID. That said, when we are advocating for it to appropriations staff on the Hill, in their bills, they still house it within the Global Health Center. I know how confusing that is, as someone who discusses this quite frequently, but I think it's important for us to at least mention. All right. Like I said, National Center for Emerging Zoonotic and Infectious Diseases plays a huge role in the global health architecture. So we focus on that as a global health community. And then also the Infectious Diseases Rapid Response Reserve Fund is a pot of money just in case there is some sort of, pandemic threat, outbreak, or epidemic that needs to be handled immediately. On the NIH side of the house, we have three key global health accounts, but that is not to say that other institutes and centers or ICs at the National Institutes of Health don't touch global health. These are just the ones that are most directly related, and those being Fogarty International Center, which I'm not sure how many people are aware of outside of the global health community, but it is the smallest center and coordinates a lot of capacity building and training and partnership with NIH researchers all around the world to other researchers who then go into usually global health security programs within country. So Fogarty not only distributes grants and serves as a center within NIH, it also is this bridge builder for the NIH to the global health community broadly. NIAID is the powerhouse of global health research and development at NIH. It is the largest funder of biomedical research and development for global health. So of course, global health equities are very strong there, focusing on NTDs, emerging infectious diseases, and so many others. And then lastly, the Office of AIDS Research, which actually coordinates all of the HIV/AIDS research that happens across the centers and institutes. So this is actually a pot of money that is decided upon through consultation with the Office of AIDS Research Director and all of the other directors and how much they are going to allot from their 27 of the ICs to this fund that funds HIV research. And again, there are a couple of others within a couple of other accounts within the LHHS bill that I am sure folks on this call care about, but these are a representative fraction of all of the global health funding that flows through the Department of Health and Human Services. All right, next slide. Okay, this is a fun one because if you look at this timeline and you read it closely, you'll recognize that this might be how it's supposed to go, but it doesn't necessarily mean that it always happens in this way. But there are some key dates and timeframes, one of which we are in right now, which is why we're hosting this meeting. But just to quickly walk through this timeline, between August and honestly March, that is when advocates are really focusing on creating appropriations requests and doing the hard work of advocacy and appropriations advocacy, both initially to the Office of Management and Budget, which theoretically in February is supposed to, release the president's budget, as you can see here. We expect the president's budget to actually be released in March of this year, a little bit later in March. But again, around February, March, usually Office of Management and Budget puts out the president's priorities through a PBR or a president's budget request. Then through March and April, yes, there is supposed to be a budget resolution, as you can see here. But that doesn't necessarily always happen. But what is always happening between February and April is the form submission process. And I honestly think that's probably the most important part of today's call. And then I know that we're going to be having a follow-up one as well. And the form submission process slash when the appropriations committees, until the appropriations committees draft their bills, are when advocates can meet with Hill staff and offices to talk about the issues that they care so deeply about, especially when it comes to global health. And this is where offices are looking for the request from the community on top line SFOPS budget numbers for all of the different accounts that Fata was mentioning, same with the LHHS numbers, but also for report language that actually goes into the bills. So in this springtime, offices are collecting all of the requests from the global health community. And then around May, offices choose their, I think the number varies, but per bill, it's usually 75 like top requests and submit them to the subcommittees on appropriations, which we have talked about, LHHS, SFOPS. And then in that May to September timeframe, those subcommittees on appropriations and then the larger committee on appropriations drafts the bills and then moves them from subcommittee to committee to the floor of the House and the Senate. So what we're trying to do as advocates is impact and influence what is obviously in those bills, so what gets to those subcommittees. So we are currently in, again, the obviously springtime of this process, where we are trying to get our requests as the global health community into those, 75 top requests for as many offices as we can to make sure that we have strong global health numbers and also strong bill language and strong report language that will get fed to the subcommittee around May. And then the subcommittee will be able to, write their bills and push out potentially 12 bills by maybe September. Obviously, we know that passing those bills is a very difficult process, and that's why we usually end up with many CRs that last after September 30th. But, you know, in a perfect world, it would work like this timeline. And because we operate within an imperfect world, we are flexible. And we keep the advocacy calendar kind of year round, making sure that every time that we can advocate, we are for, again, these top line numbers and these report language asks. Next slide. So that brings me to the appropriations tracker, which I will send in the chat right now. This is something that the Budget Roundtable is coordinating for the global health community. So I encourage you all to click on it. It has dates and form links. And basically what these are the forms, URLs to the forms per office, and the deadlines to complete those forms to make sure that you are submitting all of your global health requests on time. This is an imperfect document. It is run by us humans, and we only know so much. But we try to keep it as updated as possible so that you guys can return to it whenever you'd like to see, whose office is requesting, forms on the 27th. If you have some time, maybe on the 26th, or if you have a certain office in mind, you can check back in on, this tracker, or then also with that representative or senator's website to track if they've posted their appropriations form and if they've put out a deadline. We are trying to consolidate it here. Again, it is imperfect. So if you have specific offices that you care about and you don't see them on this form or they haven't been logged in, I do encourage you to look it up also on your own. But in the broad strokes, we do already have a lot of forms and dates on here. This is a screenshot from this morning. I've also went ahead and put the targets for LHHS and NSRP or SFOPs on the Senate side embedded within the tracker so that you know if these people are on relevant committees to the SFOP side of the House or the LHHS side of the House. You can, on your own, rank the Google Sheet by LHHS or by NSRP/SFOPs. And yeah, I think if you'd like to talk more about the appropriations tracker or anything like that, you can really reach out to me. But I know that we'll be hosting a form submission webinar as well, and this will play a huge role in that. All right, I'm done. Next slide.
Thanks so much, Alex and Fata. I know that those budget slides are crazy, and you both did an excellent job of explaining both the SFOPs and LHHS bills, as well as the appropriations tracker. That resource is incredible, and we will get more information out about our sort of forms webinar if you are more interested in engaging in that process very soon. So during the appropriations process, GHC works to ensure that our community is coordinated, strategic, and effective. And so throughout the approach season, which as Alex mentioned is sort of year-round at this point, GHC supports members and the community by aligning around the required U.S. global health investments. So we work not only with GHC members, but across the community to find alignment around funding priorities. We aim to build consensus around a shared top line for global health funding across both the SFOPs and LHHS bills, which will strengthen the overall message to Congress, try to be as united as possible, basically. We also lead sign-on letters articulating the community's recommendation for U.S. global health funding. This happens at key moments in the cycle, including a response to the president's budget request, which, as Alex mentioned, should be coming sometime next month, as well as when the House and Senate release their own versions of the appropriations bills. These letters articulate shared funding recommendations and signal broad cross-sector support. We also support congressional offices with their own sort of what they call Dear Colleague letters by providing technical input and stakeholder backing to help demonstrate strong support for specific accounts or top lines. We organize meetings with Hill staffers and the administration to emphasize the importance of U.S. leadership and investment in global health. So this includes meeting with congressional staff, administration officials, in order to reinforce the importance of sustained U.S. leadership in this area. And engagement with Congress remains really strong in our outreach to both appropriators as well as authorizers. It really remains critical to reach out to everyone. And lastly, we ensure that the advocacy community is kept up to date and aligned through monthly working group meetings and email communication, in addition to our monthly budget and appropriations working group meeting, which is coming up on Friday. We look forward to seeing you there if you're a GHC member, and regular policy analysis. Members also have access to resources like the appropriations forms tracker. Thanks so much, Alex. The budget and appropriations tracker, which tracks the fiscal year funding across different fiscal years, and a Dear Colleague tracker that shows different congressional support across different Dear Colleague letters as well. And together, these efforts help to ensure that our community is speaking with clarity, consistency, and impact throughout the appropriations process. Next slide, please. The role of GHC and members. So through our working groups, GHC members can communicate by sharing updates, flag emerging issues, and stay informed about the appropriations and policy developments in real time. GHC members also have the opportunity to collaborate by building and executing advocacy strategies and identifying important opportunities for action across different disease areas. Coordinating advocacy efforts, so aligning around top-line messaging, sign-on letters, Dear Colleague outreach, and key moments in the appropriation cycle. And lastly, in trying to increase impact, which is ultimately what we're trying to do. So through GHC, you can amplify your organization's voice by engaging as part of a broader cross-sector coalition that helps to demonstrate unified support to Congress and the administration. Next slide, please. So we know this is a complex and fast-moving environment and appreciate your patience and attention through these slides. The appropriations process can be really technical at times, but as we've discussed today, it's a really important lever for shaping U.S. global health leadership and impact. And through coordination, alignment, and sustained engagement, our community can continue to play a meaningful role in that process. With that, thank you. We'd love to open it up for questions, comments, or reflections, and are interested in hearing what you all think. So please feel free to drop comments in the chat, but we'd love to have you come off mute and give us your thoughts as well. So thanks again. And Juliet, feel free to stop sharing the slides at this point. Possible that we've stunned everyone into silence.
The presentation is very clear. That's why I don't have any question. I'm Peggy Chibuye from Zambia.
Thank you for joining, Peggy. We really appreciate that. Um, will we be sharing the slides? I think we can share the slides in PDF form, but we'll also have a recording, so you'll be able to see the slides through that as well. And your question or comment doesn't have to be super specific or in the weeds. Happy to hear just, how this webinar has been helpful, what would be helpful in the future, what other information that you're looking for as well.
Hi there.
We have,
This is
please go ahead.
Hi. This is Shani Winterstein from the Global Health Advocacy Incubator. Thanks for this. Very helpful. Looking forward to sharing it with our colleagues around the world. Does the Global Health Council and the working group have kind of a list of like the low-hanging fruit in this current administration, the areas where kind of we just need to hold the line as such, versus the areas where we're seeking kind of as a community increasing allocations or reallocations in that manner? So it's just a general question.
I can start, and I'm happy for you two to chime in. I think the biggest thing for us right now is that we were able to maintain and sustain funding for global health programs, despite and in spite of proposed cuts from the president's budget, or even some of the inklings of things that we were hearing around. It is a tight physical environment, and so priorities do shift, right, depending on congressional offices, who's in the majority, who's in the minority. And so the biggest thing for us is to continue to maintain funding and sustain the funding as it is for global health programs. Why is that? One, we see that what the last year has been very transformative for what we know as global health. A lot of the programs that majority of our organizations work with and on have been stopped. And so we are lacking a lot of data and information in the current structure to really feed into a lot of proposed quote unquote increases for certain programs. And so this year, especially as we're going to fiscal year 2027, which is weird to say because we're in the actual 2026 year, but the goal is to provide Congress with as much information, not only to make sure that, again, we are maintaining and holding the line in a new space where we're really starting from ground zero, but number two, we're making sure that on top of that, we are holding Congress accountable to not only appropriate these funds, but make sure that the administration is obligating these funds and they're being spent to the programs that they're meant to be spent to. So a lot of the conversations are around really transparency and accountability. And that is really where we're pushing Congress. It's great that you gave us this money, but if the admin is not going to spend these money, it's going to expire and we're going to have to start all over again. And so a lot of the advocacy this year will be focused on bill language, making sure that we're putting into law what Congress has proposed in their report language, which are just really suggestions for the administration to spend these funds as Congress has obligated them.
I would quickly add, which really only works to strengthen Fata's argument, that if we lose ground on anything, it's really hard to regain it rather than sustaining. So like if we were to lose a global health account completely full stop in an appropriations bill, the advocacy it would take to get it added back is so much harder than the advocacy it takes to sustain it right now. And I understand, to Fata's point, to Ansley's point earlier, these are incredibly tough times, especially on the deployment and the obligations of these funds. But that said, obviously things will change and do change, and making sure that we have strong global health language in future appropriations bills is one of the core reasons why we still have to advocate hard and all the time for these appropriations lines and language, so that when there may be a new administration that has a more, I guess, proactive approach to global health funding, the text will be there and the laws will be there for them to, follow. I think that, is something that I'm pushing quite hard. And I think that's why we're really hoping that people are using the tracker, submitting forms to, especially if you're a constituent, your Congress people, your senators, to say that these issues actually do matter because global health happens in the US, and there are global health practitioners all over. So
Thank you both. I think that was really helpful to Shani's question. I'd also just point to a question that we have in the chat about hearing a bit more appropriation structure versus deployment. So I think what Anna is getting at here is the structure that Fata and Alex went through in the SFOPs and LHHS bills. That structure has remained consistent for the most part. So Congress is still allocating money how it has been for U.S. global health initiatives. But what's changed is how the administration plans to implement and get money out the door into countries. And that's what I was mentioning earlier through the MOUs. And that uh, process for the US negotiating MOUs with individual countries has been really opaque. There are a few agreements that have been made public, but the majority have not. I believe 16 or 17 have been signed so far with country partners. Out of a total of a target 50 or 51 countries that the US aims to sign MOUs with. And once the agreements are signed, there's also implementation planning and a few other phases within that before we even get to getting things started. So some funding has continued over from previous grants that existed prior to this administration, but as you all may know, many have been eliminated. So as far as deployment, we're in a bit of limbo state, I would say, on seeing how the administration will match what's been appropriated with their plans for each individual country's MOU agreement. I'll also add, just on top of that, and welcome Fata and Alex to jump in here, that the uh, funding top lines for each agreement, so country by country, are typically far less than the money that they were receiving prior to this administration and require increasing co-investment by the country as the years go on. These agreements are typically 5-year agreements. And so as the country co-invests, the US investment decreases, sometimes quite significantly year by year. So it's a very different deployment structure than what existed prior, and we are still, trying to understand how that will all unfold and how we can best influence that process. But I'll stop there and ask Fata and Alex to jump in on that as well.
I added a comment in the chat in response to the question that, the breakdown is really just Congress controls the structure and the executive controls the deployment within the boundaries that are set within the bill. So even if, appropriation structure remains similar and we're used to the year to year, which is why we were able to go over a similar chart last year and versus this year, the deployment can change significantly depending on the administration. And so whether it's restructuring, which we're seeing now when it comes to State Department's Bureau of Diplomacy handling an implementing component of something that they were not necessarily doing in the past. And so there's a lot of creation of the new architecture that we're seeing. Policy shifts. Now we are in an America First global health strategy policy lens. And so the admin has already listed what will be the priority global health investments in that strategy if you take a close look. And then also withhold reprogramming, right? And so the biggest thing previous to Shani's question, which was around what can we do, is really the admin has the authority to reprogram how they seem fit, and that's the hardest part of this whole thing. And so it really is about maintaining a relationship congressionally as well as with the administration to really work together with what the new architecture is going to be, right? Because it's being built right now, to make sure that one, Congress has that oversight component, but also there are requirements to make sure that as we are moving into this new way of doing business, that it aligns with the priorities that Congress has set within these appropriations bills that we all, have worked hard to advocate for. And as well as these priorities continue to remain a priority for the admin as they're investing in this new way of doing business.
Thanks, Fata. Appreciate that. Liza, thanks for raising your hand.
Thank you guys for doing this. It's so valuable. A question I don't know if you can answer, but any insights you have would be appreciated. It'd be helpful to understand for me a bit more what the impacts of the bilateral MOUs will be on like multilateral processes and multilateral institutions. Do we know much yet? Thanks.
Fata, Alex, do you have any grand ideas?
No, I mean, I think, unfortunately, Liza, that is a question that I think we're all asking. And it's too bad that the MOU process is happening in such close coordination with the appropriations process, because I think that a lot of appropriators are also asking how they map our asks as a community to this new process, if it is the way that this is all going to be going. And that is true of like the lines for HIV, TB, malaria, et cetera, and then also allocating towards multilaterals, which of course this administration is skeptical of. And I know Congress, there is a lot of support for the multilaterals with Congress, but of course they want to make sure that what they put into legislation is spent and will be used in the way that they intend. So I think it is a little bit up in the air. I mean, Ansley, although you actually probably would know more than me on this issue, but that's at least my read of the situation.
That was really helpful. I think just to add one kind of aspect, and Liza, maybe you're getting at this coming from a procurement angle, is looking at, in these agreements, countries are required to begin to start establishing their own procurement lines. And a lot of work that the US has done is in partnership with some of these multilateral organizations like Global Fund or Gavi, for vaccines and treatments and other things like that. And so it's a little bit unclear how that will all unfold, how US support continues for these multilaterals, and how countries are engaging with multilaterals in this new sort of MOU environment. But Fata, over to you. I see you're off mute.
Yeah, that's a great question. I think the issue really right now is we don't know. And so there's a lot of don't knows that we're really navigating, not only as a global health community, but even congressionally, they don't know. You have where the current state and foreign operations bill, listed out support for these multilateral organizations, but there is a lot of pushback in the admin of how much funding should be given to certain organizations and which organizations the administration support and doesn't support. And so you have where Congress is trying to use their oversight capabilities to really write into law, instead of Gavi, for example, it being 2 years, the funding should be distributed. It now has to go out in 1 year. Things like that to try to redirect the admin on how they're spending and to which multilats they're spending the funding to and when it should go out. But again, right now we're in a phase where the admin, what their priorities are and what they want to reprogram will affect necessarily the end game, which is which multilateral organizations will be invested in and for how much they will be invested in. Usually we've seen where if the appropriations bill says 50 million for this organization, that we see the 50 million go out within that year. We're not necessarily seeing the same thing anymore. And so multilats are, coming to the conversation and trying to figure out ways to, have conversations with the admin. But the admin also now has their own requirements for certain multilateral organizations that they're pushing that they would want to see. And so it's bigger than just even the congressional landscape. It now goes into, right, the larger global global health architecture and what's that's going to look like moving forward. And so you have conversations of different donors, right, trying to step up or to influence the space now that weren't necessarily as privy to what the structure used to be. And so there's a lot up in the air. We're tracking, as a community, individual organizations have their priorities that they're tracking, but we're trying to track as much as possible and feed as much information congressionally as much as possible. But it's definitely a fast moving train, and we're literally picking up, pieces as we're being, as the information is being leaked, not even shared, for the most part.
Yeah, that's such helpful context, Fata. I know we just have a few minutes left, so I think we have time for one more question. And Fata, you were sort of getting at this with your last answer. Are there established mechanisms for Congress to review spending or funding that has been appropriated? How does that work? Fata used the word oversight. We are really leaning on Congress to exercise their oversight muscle. So not only do they have power of the purse in appropriating funds across the U.S. government, they also have the responsibility to conduct oversight on those appropriations. So that could happen through inquiries to the administration, letters, public hearings, or private briefings. There are a number of mechanisms through which that oversight can be conducted. And as I think Fata and Alex mentioned, our best way to influence that process is through maintaining relationships with different Hill offices and staff, folks on committee, to understand what oversight is being conducted, what still needs attention, and just providing them with some insight. They're pulled in 20 different directions every hour, and so they're relying on folks like us to help to really bridge that information gap so that they can, conduct oversight and in it ask the right questions. But Fata, Alex, anything you want to add there in the last minute?
I mean, I'll just say I wouldn't call it established mechanisms, but one of the mechanisms that has come about is really the relationship between Hill offices and the administration. And there have been a lot of, personal outreach from members that has gotten answers to questions like the one asked in the chat, which is a different advocacy angle for us because obviously we are not Congress people. But that is something that, and to Ansley's points, why it's so important for us to maintain these relationships, especially during the appropriations season, so that we can come back and say, hey, in the report language, it said within 60 days, we'd get a, description of what the innovation fund is. Like, have we received that yet? If not, is there anything that your office can do in terms of outreach to the administration to see like how that is going? So that is the other part of this that I know that many advocates are having to grapple with.
I'll keep mine short since we're at time. The other ones not noted yet is around, reports, spend plans, whether it's allocation tables or CN's congressional notifications of the process, so that Congress kind of knows, like, okay, you have to notify me if you're reprogramming these funds, shifting monies between accounts, launching any new programs. Also, there's also the Government Accountability Office within Congress, which hasn't necessarily exercised their arms yet, but that's another possibility for audit of agency spending that can happen, and investigation around like compliance that usually happens, and then like the other is like the Inspector General's office. So there are different ways that you can go about the accountability mechanisms to make sure that money is being spent. But again, Congress moves very slow as the admin is moving very fast. So you may have a hearing for something that happened a year before and it's already happened, and we're now reaping whatever has happened. So you kind of see a mixture of that happening. I'll stop there.
Fata, that's such an important point of the speeds at which the administration and Congress are moving, and not necessarily always the same. But we're at an overtime. Really appreciate everyone joining here. Please feel free to reach out if you have any questions or comments or wanted to let us know anything. For GHC members, hope you can join us at our monthly budget and appropriations working group meetings, which the next one will be on Friday at 10 a.m. Otherwise, we'll be sure to circulate the recording. Thank you again for joining, and look forward to engaging with you all again soon. Thank you.